Doctors and medical professionals must provide emergency abortions at hospitals across the country, regardless of what the state laws say. So says the federal government. Now, I actually reported this was going to happen in several videos that I've done over the last few weeks, but the Health and Human Services Secretary officially just put out the guidance that all physicians in America need to follow. In this 2-page letter, he lays out the responsibilities and legal obligations of physicians and medical personnel under the Federal Emergency Medical Treatment and Active Labor Act. That law, passed in 1986, requires all hospitals that receive Medicare funding, which is like all of them, to provide patients with appropriate medical screening, examination, stabilization, treatment, and transfer if necessary. The physician or qualified medical professional has a legal duty under this law to provide stabilizing medical treatment to a patient who presents with an emergency, including, but not limited to, ectopic pregnancy, complications from pregnancy loss, and emergent hypertensive disorders like preeclampsia. And yes, by federal law, that stabilizing medical treatment can be an abortion, and no, it doesn't matter what the state law says. Now, it has been reported that some doctors in states with strict new abortion laws, especially those with limited exemptions, have been uncertain about what they can and can't do in an emergency, even if their patient needs an emergency abortion. And that can lead to delayed treatment, which then puts the patient at greater risk while they wait for hospital lawyers to sort out the discrepancies between the federal and state laws. But as of now, according to the letter from the federal government, medical professionals don't need to wait anymore. Now, that's not to say physicians are completely absolved by this law. Doctors can still be sued if they provide an abortion and it's not legal in that state. But the 1986 law, according to HHS, would be their defense in court. Now, because the Dobbs ruling by the Supreme Court is so new and it changed so much, it's going to take some time to sort out all the ramifications. Now, as I told you, again, in all these videos, this will not be the last we hear about all of this. Both the White House and the Department of Health and Human Services say more action on this topic will be announced soon. You can check out reproductiverights.gov for more information, and I put a link to that and a bunch of other important information in the link in my bio.